All right, class. In this video, I'm going to be going over the second part of Chapter 7 on proteins. We've already kind of looked at what proteins are, some examples, how they're used in the body, a little bit about their structure, amino acid structure, and that sort of thing in Part 1. And so in this video, we'll look at a few general dietary recommendations about proteins, and even some problems or some potential issues that some individuals have with proteins in their diet. And so let's just kind of start by looking at some general dietary recommendations and how proteins affect our overall health. And so you can kind of see here that having a lot of protein in the form of red meat or processed meats can have problems with our overall nutrition and health, mainly because there again, the saturated fat content is generally higher. Sodium, salt, that's generally higher, especially in things like processed meat. That could be, deli meats. It could be bacon, sausage, bologna, those types of things, pepperoni. Any of that type of processed meats generally are higher in saturated fats, generally higher in salt, sodium, even some preservatives, nitrates that are out there, some other chemicals and things. So it's generally recommended to try to, have some guidelines, some limits on red and processed meats for that reason, that it can lead to increased risk of things like cardiovascular disease and potentially some types of cancers. And there is research that does link the high intake of the correlation between the high intake of red and processed meats with certain cancers, especially in the area of the colorectal area, pancreatic cancers, and potentially stomach cancers. So, of course, your book does a good job of kind of providing some just general recommendations for proteins. If you do eat meat, then maybe a couple of guidelines here just kind of look at. Try to find lean cuts of meat just to try to reduce that saturated fat that's there, or just some low fat poultry. Some chicken breast meat that is lower fat than other cuts and things. Leaner cuts of meat, you can kind of see those listed there. Leaner cuts of beef, even pork. There's options out there for leaner cuts of pork, whether it's a pork loin or tenderloin or something like that. If you've been grocery shopping and you've looked at the ground beef counter, you can find leaner cuts or leaner selections of ground beef, and you can get some very lean ground beef, even up to 95% of lean ground beef, and so that really decreases the overall saturated fat content. Obviously, trimming off any visible fats, even things like poultry and chicken, that you can remove the skin ahead of time and or before you eat it, and so even things like that can help as well. I mentioned also the processed meat, deli meats, bacon, hot dog, sausage, all those things there. And then anytime that you can add fish to the diet, there's whole dietary guidelines or dietary plan based around the Mediterranean diet style, which is has a high fish protein source with it. And then so that's a very good alternative. And then any kind of protein rich plant sources, of course, any kind of legumes, beans, peas, seeds, and then nuts, of course. Section 5 just kind of shows you what a nutrient label would have on it as far as protein goes, and it's really not very much information. It's not divided into types of proteins or complete or incomplete, high quality, low quality type proteins or anything like that. It just shows you the total amount of protein for that serving size. And so again, if you see something like this is 3 grams of protein in that particular serving size. So you have to kind of go back to the top and realize that this serving size is 3 of these little flatbread type cracker, it looks like. And so 3 of those would contain 3 grams of protein. And of course, it does give you your daily value percentage. It represents 6% of your daily recommended amount of protein there. One concept for proteins is to, again, making sure that you're getting all of those essential amino acids in your protein. Remember, there's, about 9 amino acids out of the 20. There's about 9 that are considered to be essential that we have to get in our diet. And so if you are, trying to cut back on animal products, and if you're a vegetarian and you're not eating animal products, it's very important to make sure you are getting all of those essential amino acids. And so this is where complementing proteins together, certain proteins together, allows you to make sure you're getting those essential amino acids. And so that's kind of like, the classic example would be like beans and rice. Some kind of bean by itself may not have all 9 of those essential amino acids, but when you complement that with something like rice or another grain product, then that kind of usually has the missing amino acids, the remaining essential amino acids that you would need. So putting those together means you've got a complete protein. Even something as simple as peanut butter and whole wheat toast or whole wheat bread, those complement each other because of the amino acids present in both of those. And so, and that's just because certain plant proteins are limiting some type of amino acids. You don't have to memorize these, but legumes, beans generally seem to be lower in these 2 amino acids, cysteine, methionine, and then grains, wheat, barley, rye, oats, sometimes are low in other amino acids, lysine, threonine, tryptophan. So that's why combining beans and some type of grain really work together, because they kind of complement each other as far as amino acids go. All right, section 8, we'll look at, where I mentioned, kind of looking at how much protein we have in our diet, and there's recommendations on even how to calculate that. We've already mentioned how too much can be a bad thing because of the cardiovascular disease, possibility of cancer, but even things like uric acid. If you've ever heard of something called gout, or if you know someone, or if you've experienced something called gout, that's where uric acid basically kind of crystallizes and gets into your joints. Usually you hear about people having gout in maybe a knee or an ankle joint, or even a hand or a toe joint somewhere in there, and it causes a lot of pain in that particular joint. And so it turns out that certain protein-rich foods have chemicals in there called purines. They are nitrogen-containing ring carbon structures with nitrogen there, and they're not proteins themselves, but they're chemicals kind of found within protein-rich foods. The problem is that some of these purines is that whenever your body breaks them down, it produces a metabolic waste product called uric acid. Your body has to get rid of it, but sometimes that uric acid gets in higher concentrations and can settle out or precipitate out and get into a joint cavity somewhere, potentially could lead to kidney stones, formation of kidney stones. And so, the idea is try to limit certain foods. I didn't have really a list here. You can look up, you can Google something, but certain things are higher. Certain types of meat products, beef, pork, lamb, these are generally higher in purine substances, purine chemicals. Even things like tuna has a little bit higher purine source than other fish. So something to kind of look at. You probably are familiar, and I know we've been doing some case studies already with things like an Atkins type of a diet, protein power. That's just another version of some of these paleo. That's kind of another version of a high intake protein diet, or of course the keto diet, things like that. A lot of times these are promoted for losing excess weight, losing weight loss very quickly. And that's just having high intakes of protein, minimizing carbohydrates usually. And so there's some good benefits, of course, because it does cause an increase in loss of body fat very quickly. You lose body fat very quickly because you're starting to burn that fat. It does reduce the feeling of hunger. And that's one of the nice things about protein anyway, is it helps us to feel full longer. That's called satiety whenever we have that feeling of fullness. But just like with a lot of fad type diets, it's usually hard to maintain for long periods of time. And even, it's suggested not to continue with certain types of these diets for a long period of time. Can you have too little protein? Yes, of course. You can have a low amount of protein, too low. Generally, it's not very common in the U.S. We do have wide access to different types of protein, whether it's meat sources or plant sources, or protein shakes or protein powders and things. So you do find that having the right amount of protein is generally not a problem. Sometimes you do see it in older adults, especially those on a low income level. It could be a situation that someone has a chronic disease. We'll talk about a couple of examples where maybe they have some allergy to certain proteins and make it difficult to have the right amount of protein. But anytime you're dealing with low amounts of protein, it's generally referred to as protein energy malnutrition, because the individual may be lacking or not able to absorb in their inside in their intestines, absorb the high quality protein or the amino acids that they need. And because protein does give us energy, that individual may have protein energy malnutrition. Section 9 is a good section because it introduces us to food allergies. Some of you are very familiar with food allergies. You may have you may have experienced food allergy before or know someone that has, and you kind of see a little book type definition here: the inflammatory response resulting when our body's immune system is really reacting inappropriately. It's trying to do what it's supposed to do, and that's correct a problem. But a lot of times it reacts in a hyper state. It reacts too much or too quickly, and to something that is usually harmless. In this case, we're going to talk about proteins or amino acids that sometimes trigger some type of food allergic response. But it's basically your body's immune system really overreacting, if you want to think of it that way. And the result is inflammation in the area, and that can cause some digestive problems. So we're going to see that here. Anything that causes this type of inflammatory response is known as an allergen. It could be, you're talking about if you have seasonal allergies and you have an allergic, you have hay fever, or you have allergies to pollen, of course. That allergen is the pollen. You may not have near as of a condition that some individuals have with a food allergy, but it's still an allergy, and it's still an allergen that is the offending substance that you have a reaction to. A lot of the food allergies that we know about come from proteins, or they come from the amino acid that's part of the protein. Usually it means that protein doesn't get digested correctly. It doesn't get broken down correctly into the amino acids. Sometimes it does, but usually it means it doesn't get completely broken down, and that causes some problems, usually many times in the digestive tract, like in the intestines. So what are some signs or symptoms of some general food allergies? Most of these are pretty basic, pretty familiar. A lot of times you see some type of hive or kind of raised maybe itchy bumps on the skin. That's pretty common. Even swollen or itchy lips, or even like a burning sensation around the mouth. Um, we found out early on that my daughter has had an allergic response to a cashew. I had previously never heard of people being allergic to cashews, the cashew nut. That's different than a peanut, but that's one of the symptoms that she had was her lips were starting to swell a little bit, and she was kind of complaining that there was a itchy type burning sensation, around her lips and mouth, and so those are very common as well, especially early on. Could have skin flushing. That's extra blood flow kind of going to the surface of the skin, usually, especially around the facial area. Could lead to a rash in a particular area, such as eczema. More severe things could be difficulty swallowing. Your esophagus, um, is surrounded with muscles. It's a muscular tube, and so it can begin to constrict and make it difficult to swallow. Wheezing, difficulty breathing if your airways begin to constrict. That's a very serious condition, life-threatening condition, and so if your airways begin to constrict, it can make it very difficult to breathe. If you're experiencing abdominal pain, and potentially vomiting and diarrhea, and a lot of times that's because of the intestinal areas are becoming inflamed. If it's severe enough, we call this anaphylaxis, or you may have heard of anaphylactic shock. And that's where these types of conditions are proceeding in a rapid rate, and have some very life-threatening responses, such as that difficulty breathing or extreme pain in the abdominal area, difficulty swallowing. Just to mention a few of these common food allergens that's been seen. And again, not everything is a protein, but many food allergen substances, molecules happen to be proteins or amino acids. And so there are certain proteins in cow's milk that have been shown to cause a food allergy. This is why most pediatricians recommend not giving infants cow's milk until they're at least a year old. And because, having a food allergic response or anaphylaxis can be definitely life-threatening for a newborn, even more so for a newborn. And so you want to make sure that for a newborn up to a year old isn't being fed cow's milk, so that you can kind of test that out a little bit later and they're a little bit stronger. Eggs, protein in eggs like albumin. Some people have allergies for that. Peanuts, of course, we've all heard probably of individuals with a peanut allergy. Wheat has several different proteins there, but one of the main ones that we hear about is gluten. Gluten, the protein. We'll talk about that briefly in a minute, which leads to celiac disease, soybeans, and then fish and shellfish. There are certain things that aren't protein related, that can still be part of our food, and can be considered allergens, like some of the dyes. Some individuals are allergic to certain food coloring dyes that are found in even things like children's candy or popsicles and things that are used to color food with artificial dyes and things. Sometimes chemicals are added, such as sulfites or even nitrates or nitrites that are added sometimes like as preservatives or part of the flavoring in different things. And sometimes those can cause some type of allergic response as well. If it seems like that food allergies are on the increase, I haven't done any exhaustive research on this, but I have looked up some things on that, and it does seem to be true. That it does seem that food allergies are on the rise, and they have increased. And you can kind of look at some theories behind that, some explanations behind that, but it does seem that more and more individuals do have some type of food allergy. Now, the other thing is sometimes food allergies come and go, right? So sometimes individuals may grow out. So I mentioned my daughter earlier. She was tested just a couple years ago, and she no longer demonstrates any kind of allergic allergy anymore to the cashew nut. So, some it's possible to have a food allergy, then have it retested, and then that food allergy is no longer there or as severe. What can we do to treat allergic responses? Of course, obviously avoid any, you have to identify what that that offending food is. You have to identify that, and you can go to your healthcare provider and they can run some tests and find out what is it that's causing the allergy for you. And then of course you can offend that. That's why reading the labels and kind of finding out what's in the package, even where it's been processed. You'll see that if you look on food package labels, if it's been processed in a place with other allergens like nuts, even the dust that's in the packaging can create an allergic response for someone that's very sensitive to that particular food allergen there. So once you've identified it, once you've kind of checked the packages and stuff, just make sure you educate people that's going to be around you or around children, especially, to let them know, hey, this is a situation. Make sure you have your healthcare provider can possibly give you more information on what is the treatment if there is a reaction. Maybe it involves an EpiPen, which is an injection of epinephrine that's going to help, allow the airways to relax and allow you to have better airflow to the lungs. It increases heart rate a little bit, make sure the oxygen gets distributed throughout the body. I mentioned briefly celiac disease, just a couple things here. You do hear about this, again, a little bit more than we used to, I suppose. This seems to be, has some hereditary conditions there. It seems to be inherited, or at least running in families, I guess. And it's basically where foods that contain this protein, gluten, we hear about gluten, but a lot of times we don't think of it being a protein because we automatically think of wheats and bread products and pasta and starch and all of that, carbohydrates. But gluten is a protein, and it's found in wheat, barley, and rye, in these grains. And so individuals that have celiac disease, they're allergic to this protein, and that causes inflammation inside of their intestines, inside of the small intestines. If the intestines become inflamed, then it makes it very difficult for the intestines to do what they're supposed to do, which is absorb nutrients. And so they lose the ability to really absorb the nutrients. That's called malabsorption of nutrients. The intestines don't absorb the nutrients like they need to. It could potentially even damage the intestines. The villi structures are the kind of finger-like projections inside the intestines that help to do the absorption process. That's where the little capillaries are at, that are absorbing the nutrients into the bloodstream. It can actually damage, if the reaction is severe enough, it can actually damage those villi and again lead to more malabsorption of the nutrients. So even though the individual may be eating and being able to digest a protein into different nutrients, into the different amino acids, if you can't absorb it into the bloodstream, then you've got a problem there. And of course, celiac disease, because of the inflammation, is going to cause different types of symptoms, including abdominal bloating, pain, cramps. It could cause diarrhea, again, because of the inflammatory response there. Because the individual's not, if they continue with this, they could potentially lose weight. Part of that's because of the diarrhea. Part of it may be because they're not eating as much. Part of it may be because that they are not absorbing those nutrients like they should. That could even lead to poor growth, especially in children. Even though there's no cure for the disease, we have options now that we can find gluten-free products. Gluten-free foods are a little bit more commonly available now than they were 5 or 10 years ago. And so You've got to be a little more selective, of course, on certain things that you can have. But when you exclude wheat, barley, or rye from your diet, then you generally don't have those symptoms because that's, if you avoid the gluten, and like I said, there's, a lot more products now that are gluten free. So it does obviously take some adjustment because you are going to have to do a little bit more diet planning. You're going to have to be a little bit more careful with, selecting those gluten free foods, but it's very manageable now because of the availability of more gluten-free food sources. One more disorder, you may have heard about this. You don't hear about it very often. It is a genetic disorder, it is fairly rare. I've actually only heard of one case of someone that I knew of that had this, but it's called phenylketonuria, or PKU. It turns out this an individual with PKU doesn't have the correct enzyme, or is not producing the right amount of the enzyme to break down a particular amino acid, phenylalanine. What that means is if you don't break this down, it starts to build up in the body. And once it builds up to certain levels, it can actually damage tissues. It becomes toxic at certain levels. Usually newborns are tested for this. They do like a simple little blood test, and that immediately kind of checks to see if they have this disorder or not, because they need to know if they need a diet that is free from this particular amino acid. And so they need to know right away if that's needed. The problem with, or one of the problems with the PKU is that it's sometimes hard to find foods that don't have this amino acid in it, because it's very common. It's a protein. It's in a lot of proteins, and so you can have plenty of fruits and vegetables, but you're limited to the amount of protein sources you can have because of the widespread location of this, the location of this amino acid, phenylalanine. So things like nuts and milk, dairy products, and eggs and meats, animal products. So lots of things have protein source in it, of course, and so it's very difficult for this individual. They had to be on a very restricted diet to try to find foods that are low in this particular amino acid. One of the places you may have seen PKU, if you look at the little sweetener packs, you're familiar with like something like NutraSweet or Equal, it contains aspartame. What turns out that aspartame, this is a sweetener, artificial sweetener, non-nutritive. It doesn't provide any calories, so it's non-nutritive sweetener. Has two amino acids. It's got aspartic acid and phenylalanine, and so that is a source of the aspartame is a source of phenylalanine. And so there's a little warning on, or it used to be, it should be there on Equal packs and NutraSweet packs, warning that if you have PKU, then obviously you can't have the aspartame sweetener. All right, guys, hopefully that was helpful a little bit to kind of go through the remaining part of chapter 7. Thanks, guys.